Hi guys, I'm Madeline Murray and I'll be doing my presentation on Capgras syndrome. Capgras syndrome, also known as Capgras delusion, is a type of delusional misidentification syndrome where individuals believe a family member or someone close to them has been replaced by a double or an imposter. In some cases, people believe that their animals or objects have been replaced as well. Because of how rare this syndrome is, there isn't really a diagnostic criteria for Capgras. It just depends on the symptoms and description to be diagnosed. This syndrome can come from dysfunction of the inferior temporal cortex, which is involved in facial recognition. It can also come from a dysfunction of the amygdala, which is involved in emotional regulation. These structures might be damaged independently, where the individual might be able to recognize the person but have no emotional connection to them, causing them to believe that the imposter has taken over. Some of the other causes could be trauma to the head, cerebral infarction, metabolic disturbances, post-ictal delirium, dementia, or Alzheimer's. And here is a video of somebody explaining their experience with Capgras.
He had one profound delusion. He would look at his mother and he would say, "This woman, doctor, she looks exactly like my mother. But in fact, she's not my mother. She's an imposter. She's some other woman pretending to be my mother."
The injury to David's brain had brought on a very rare condition called the Capgras delusion.
I was cooking dinner, and he probably didn't like the food that night. Okay. And he said, the lady who comes in the morning, she cooks much better than you. It's that lady. I like that lady very much. Okay. But the lady was me, of course, all the time.
David was also convinced that his father was an imposter.
He would say to his dad, I'm sure you would like to meet this guy. He's so much like you, but he drives better. He doesn't go so fast.
It can look identical to him, exactly like him, but it's not him.
After 2 months of this disturbing behavior, David's parents decided to seek help from Ramachandran.
Yeah. But when you looked at the person who looked like your father, what was your feeling? Did it look like there's some other person who resembles your father? Is not really your father, something like that?
Exactly. There's a difference at the fact that I know that person happens not to be my father.
Uh-huh.
It is not my father or my mother, right?
Okay.
I don't expect things from that person as I would expect from my parents.
No?
I got to call the teacher today.
David not only had delusions about people, he also believed that the house that he lived in was just an imitation of his home.
One day he started getting really angry. I want to go to my house. I want to go to David's house. I want to go to David's house. And we're in the apartment. And I'm just going, what am I going to do? So I decided, I said, okay, David, let's go. So I took him down the stairs. And I went around through the back, came back through the elevator, took him to bring, the same apartment. And I said, this is your house. And I opened the door and I said, okay, ciao. And I just left him there alone. It was the same apartment.
This is just showing one of the ways where Capgras affects somebody, where in David's experience, he not only believes that family members have been replaced, but also his home. Capgras is a rare condition that affects about 1% of the general population and is found more in women at about a 2-to-1 ratio. And the age of onset depends on the etiology. If it's caused by dementia, it might appear a lot later in life than it would if it was caused by trauma from a car accident. This syndrome hasn't been shown to lower one's lifespan, but it can have some legal ramifications, especially if the individual ends up hurting their loved one trying to get rid of the imposter. The most common symptom of Capgras is believing that somebody close to them has been replaced. Some other symptoms include aggressive behavior, disassociation, along with auditory and visual hallucinations. All populations are at risk of getting Capgras just because one of the causes is trauma. Anybody can be injured in a way that could cause this condition. And it has not been shown to decrease a lifespan unless they were to harm themselves in any way. Some related disorders include Alzheimer's, Lewy body dementia, schizophrenia, bipolar disorder, and multiple sclerosis. And some risk factors of Capgras are homicide, as 1 in every 10 individuals has attempted to harm the imposter, and self-harm, as another 1 in 10 have also attempted to harm themselves, and again, aggressive behavior. While there is no cure for Capgras, we can use psychotherapy and treat the underlying conditions to help them. Okay, so when I was looking for community support, I could not find any local support for Capgras syndrome, so I started finding some that would help with the symptoms. So there's an anger management group therapy in Flint that can help them control their anger. There is Life Point Counseling in Lansing, which focuses on many disorders, but one of the main ones being bipolar disorder. And then in Plymouth, I found a caregiver support group to help those caregivers better understand what's going on. And all of these groups are available in person and online through telehealth. The performance areas affected really depends on the related conditions. So the related conditions could make it very difficult for one to participate in their occupations like ADL. Rest and sleep might also be disrupted if they stay up all night thinking about the imposter or thinking of ways to try and get rid of said imposter. Social participation in leisure may also be impacted, as they might not want to participate in their leisure activities either by themselves or with someone else just because they don't want to be with that loved one at the moment. Client factors like body functions and beliefs might also be affected due to changes in attention, thought, and orientation. Performance skills like social interaction skills will be affected, changing the way they interact with their loved ones. Their performance patterns like habits and routines will change, as they will be adding new routines onto the old ones. Like they might become part of their routine now to take medicine, or look for identifying features in their loved one to know that it is really them and not an imposter. This can also change how they interact in their social, physical, personal, and temporal environments. There are 2 different ways we can use evidence-based medical treatment, one of them being therapeutic and intervention, where we can use validation therapy to help them support their delusions instead of reject them, to help reduce some anxiety and panic in the patient and make them realize that their feelings are valid and that they aren't crazy. We can also use psychotherapy to help patients and families cope with what's going on and to help to build that relationship between them. Cognitive behavioral therapy has also been shown to help. And we would also like to use some pharmacological interventions like antidepressants and SSRIs to help with that anxiety and depression, as well as psychotropic medications for hallucinations, and working with the primary care physician to treat any other related disorders. As an OT, we really want to focus on the symptoms of Capgras to help them with that. And one of the symptoms we can really help with is hallucinations. We can go through their occupations and help them reduce the disruption in areas of their work, leisure, and ADLs to help them be more involved. We can use the model of functional deficits and help modify their environment to facilitate better coping strategies. We can also help treat disassociation with education and focusing on purposeful tasks to create a bond to the task to help lower that disassociation. Sensory motor activities has also been shown to help reduce stress, which will reduce the disassociation. And here are my references. Alright, so now we're going to go ahead and play Capgras, 2 Truths and a Lie, if you guys want to go ahead and play along and see if you can figure out which one's the lie. So first we have symptoms. Are the symptoms visual and auditory hallucinations, aggression, or insomnia? Well, if you thought insomnia was not a symptom, you were correct. Next, we have risk factors. Which one is not a risk factor? Aggressive behavior, substance abuse, or homicide attempted or committed? Substance abuse. Treatment. Which one of these is not a treatment? Psychotherapy to help treat the underlying conditions, or holistic approaches such as acupuncture? Holistic approaches. And finally, we have related disorders. Which one of these is not related? Diabetes, schizophrenia, or bipolar disorder? Then we have diabetes. All right, well, I hope you enjoyed this presentation and learned a little bit more about Capgras syndrome.